Yeah, I'll react to that, sure.
Healthcare.
French healthcare this time, guys, all right? I've looked at UK, Germany. I'm very uninformed on a lot of this stuff, all of it, but I like learning about the different healthcare systems compared to the US. We're doing France this time. Let's
is becoming a big issue in the 2020 elections. The Democrats are pushing for a government-funded model, while President Trump is campaigning on gutting Obamacare.
We repeal the core of the disastrous Obamacare. The individual mandate is now gone.
Medicare for all has become a mantra among left-of-center Democrats in the presidential race.
Healthcare is a human right.
Is a human right.
I strongly believe that we need to have Medicare for all.
I am a strong supporter of Medicare for all.
The candidates do have
I like doing impressions. I'm not a Bernie hater. I'm not a Bernie lover, but I'm not a Bernie hate, all right? But
I love doing his impression.
Interpretations of what
Medicare for all.
The candidates do have different interpretations of what Medicare for all actually looks like in America. Those differences aside, it's essentially a universal single-payer system, closely modeled after Canada's healthcare system. But there's another national healthcare system that gets a lot of attention: France. Back in 2000, the World Health Organization ranked it as the best national healthcare system in the world. A lot has happened since then, but France's healthcare system remains a model for universal coverage. Here's why.
okay, as we get into it, guys, I watched the UK, I watched German healthcare, and they did have big differences. I think German healthcare had much more private implementation in the healthcare system than the UK NHS did. And I'm hoping that France has something a little bit different than both of them, or than either of them. Just to get a better look at how healthcare systems can be different. And I'd love to look at more countries after this. So if any of you guys have ideas for that, I'll love to see them in the comments. Different countries.
Despite spending less on coverage, France has comparable or even better healthcare outcomes than the United States. The United States has a higher rate of infant mortality. In France, nearly 4 children die out of every 1,000 live births. In the US, that number is closer to 6. France also has a higher average life expectancy than the United States by 4 years. And the rate of rehospitalization...
Guys, I used to think...
higher average life...
The more I've learned about life expectancy, that is a very big gap. It's like, oh, only 4 years. But when it comes to life expectancy, they're kind of 4 years is a very big difference.
Expectancy than the United States by 4 years. And the rate of rehospitalization in France is 5.3% lower than that of the United States. Lower rates of rehospitalization in France are likely due to better access to primary care, as well as longer average stays in the hospital. Since France gives every citizen coverage from birth, the system allows them to get more preventative treatments throughout their lifetimes, which save on costs and improve outcomes.
Guys, preventative treatments are like, aren't they like, like shots? To take health early, include exams, shots, lab tests, screenings. Okay. So stuff that just help you get ahead of something worse you might have. All right.
Which save on costs and improve outcomes. After World War II, French politicians were concerned the country's private healthcare system would not be able to handle coverage demands. So the country established a model of national health insurance, meant to protect the population against increasing healthcare costs. The French call their system Social Security, but it is not an example of socialized medicine. It's not government-run, just government-financed. It's very close to being a single-payer healthcare system.
I'm Pierre Joffard. I'm a professor of economics at the Paris School of Economics. Every individual who lives in France, whether he or she is a foreigner or a French citizen, is covered by basic social security. Everyone has access to care. Doesn't mean free access to care, but access to care with reasonable copays. So
This mandatory coverage doesn't come at the expense of freedom of choice in medical care. The system is set up to ensure that doctors are not restricted when making medical decisions.
The system covers every doctor, every lab, every hospital, every clinic. They're all covered, and they all have to take the patients.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
America's the only place where we have what the insurance companies call narrow networks, where they dictate which doctors you can go to. No other country does that. In every other country, the patient picks the doctor and the system pays. That's also true for our Medicare system. Medicare covers all doctors. So here's what happens in the United States. Let's say somebody, a clerk in 7-Eleven or hotel maid has no insurance or very little insurance, and she feels a vague pain on the right side of her abdomen. It would cost her $120 to go to the doctor. She's not going to do that. She's going to work through it. And 3 months later, she's in the emergency room, a burst appendix. It costs $60,000. And we'll treat her. We'll treat her. But if she could have gone to the doctor when she felt that first pain, the doc could have treated the infection. It would have cost $100 instead of $30,000.
That this is the most frustrating part, I think, about American healthcare, is that I can't believe that you have to. I feel like there's a joke in America. Maybe you guys probably know it too. Maybe no, but where you have a serious injury, it's like, oh my God, I'm gonna die. It's like, okay, I'll call an ambulance. It's like, no, wait, never mind. I'm fine. I'll walk it off. I'll sleep it off, because my uncle died of lung cancer. Maybe 10 years ago now. But maybe if he caught it earlier, then he could have had a longer life, or at least, prolonged of how short it was. And that's infuriating. Why is it that you can't have guys, why is it that you have to see someone who went to 8 years of college and post-grad and is a specialist, and you're gonna have to pay him a lot for something that a much lower educated nurse or sub-nurse level could check just to see if you're doing okay, so you're not worried about this giant bill that could wreck your life, and have to choose between being terrified if this is life-threatening and ruining your life with a bill. I hate that.
The way we do it, by definition, makes things much more expensive, because covering everybody so that people get the care they need when it's still early and cheap is a much smarter and a much less expensive way to provide health care.
France's Social Security reimburses around 70 to 80% of medical costs, leaving the remaining amount for patients to pay out of pocket. France also has voluntary supplemental health insurance provided by private insurance companies.
But in France, they want you to know that you're getting something of value from the healthcare system, so they make you pay, and then everybody in France gets about 80% of it back from the insurance company.
France's Social Security also legally requires price transparency, and because the government-funded system covers the entire population, it has more bargaining power to keep the prices low. Social Security also has no waiting list for specialized hospital treatments. There's also no physician gatekeeping.
That's a little confusing. I thought this was one of the few drawbacks. You see, it's when somebody from a country in Europe that has a good healthcare system, better than the US, tells me that there's no drawback, is when I get skeptical. And it's infuriating, because even if you mention the drawback, your healthcare system is still way better than the US, and you're only hurting the cause of people coming over to that. Of course, you're going to have, I'm not saying that this is incorrect here, by the way, but of course, maybe you'll have longer waiting times. Maybe I don't know. Maybe there'll be some drawbacks, but mention them, and it'll make it so much easier for people to get on board, because they won't be skeptical of someone saying there's no issues. Say maybe the doctors get paid less, maybe you lose some over, but at the end of the day, you're still better. And so I'm not saying this isn't true. I'm just wondering How is there no waiting list?
Patients do not need their general practitioner to sign off so they can see a specialist. So how does France's system stack up against America's? The French healthcare system is considered one of the most expensive in the world, and yet it's still half the cost of America's. In 2017, U.S. spending added up to $10,200 per capita. In France, it was only $4,900. Administrative costs are also much lower in France than in the United States.
In France, they're limited to 5.5% of the bill. Whatever the bill is, the administrative fee can't be more than 5.5%. In America, our private insurance companies have administrative costs of 20% on every bill. And that's so important to our insurance industry that their lobbyists wrote that into Obamacare, that they're allowed to add 20% administrative costs.
One of the ways the French keep their administrative costs lower is with the carte vitale, a health insurance card carried by every French citizen. When a person visits a doctor in France, they present their carte vitale so the doctor can look them up in the digital system. The card gives the doctor all the information they need to charge for the visit. French citizens can also opt to have all their medical records stored on a card.
That's a great example of how this system looks after more of its total population, and the American system looks more after the business. It's like, why not have this? Why not make it so any doctor you choose to go to has the medical records and your health records from any doctor you went to prior to that in some sort of generalized countrywide system? The only reason I can think is because it's competition with other people, and yeah.
Hard for doctors to access. And because the system is available all over the country, it saves time and money. Another way France manages rising healthcare costs is by having the government regulate them. Unlike the United States, where legislatures are deadlocked on what to do about healthcare, the French parliament votes to set new healthcare budgets and guidelines every year.
The parliament votes every year on, called an objective, but it's kind of binding. The objective national de dépenses d'assurance maladie, so the national objective for social security expenditures, and everything, and all expenditures have to stay in that budget. Of course, they don't always do, but still it's a very effective way to control costs.
But France's healthcare system is not perfect. French citizens pay significantly more income tax than Americans in order to cover.
This is what makes me so much more confident and believable in your system, is when there are negative stuff. Okay, what is it?
Perfect.
I'm sure
French
it's still better.
citizens pay significantly more income tax than Americans in order to cover government-funded programs such as Social Security. Many French employers say high taxes do restrict them from hiring more people.
People are very happy to pay nothing out of pocket. They don't always realize that on average they pay about 3,000 euros per year.
See, that's the kind of thing that I don't understand, is that some people actually think that completely, more nationalized government-funded healthcare for everyone has no other bad consequence, even if that bad consequence is minuscule compared to the bad consequences of an American healthcare system, that you're surprised you don't know that you're paying more in taxes for the free healthcare. I mean, come on. Yeah, there's going to be some give and take. It doesn't mean it's not still worthy to point it out.
Why is that on average they pay about 3,000 euros per year?
But the United States' lower tax bite is countered by the fact that Americans end up paying more in premiums and out-of-pocket expenses each time they require medical care. Additionally, doctors in France make less money than those in the United States. French general practitioners make on average nearly $112,000 a year. In America, a general practitioner can expect to make around $218,000.
I didn't think it was going to almost double. Pretty much double.
Gap in wages, however, does not factor in the cost of becoming a doctor in each country.
Which means, why not study medical, to become a doctor in Europe and then get a job in America? So you don't pay nearly as much in medical school in Europe as you would in America, but you'll still get the salary if you go to America that might contribute to some sort of brain drain.
American doctors must take on the cost of medical school, while French doctors receive that education free. American doctors also must pay for malpractice insurance, whereas such lawsuits are not a big issue in France. A common
So what happens when there's medical malpractice?
complaint in France is that certain areas do not have as much access to healthcare as others. However, France has more doctors per resident than the United States does. For every 1,000 residents, France has 3.4 doctors, whereas the United States only has 2.6. Some French hospitals are also struggling with the rising costs to care for patients.
The fact that budgets are very tight generates lots of tension. So hospitals are under lots of pressure right now.
So what can the United States learn from the French system?
A lot.
France's Social Security proves it's possible to cover every citizen without a government-run system regulating choice and how doctors practice medicine. It also shows that universal healthcare coverage can coexist with private insurance.
Basically, France has really done it right. As the World Health Organization said, very good health outcomes. Everybody's covered, all their citizens, all their alien workers, tourists, and half our costs. So I think they're doing a lot of things right.
Really interesting, guys. I can't learn everything from a short little video, but I've enjoyed learning about the UK NHS, the German healthcare system, and now the French healthcare system. Of course, I'm not solid. I don't have a solid understanding of either three yet. I've only seen them on videos. I don't know much about healthcare to begin with, but it seems like America really prioritizes profit, or really sees its healthcare system as more of a business than other places do, which means that maybe you'll if you're a doctor, you'll get paid more. Maybe there won't be as much of a wait in getting medical treatment, which in this case said that France actually doesn't have a problem with that. But again, I think if anyone tries to say that there's no downside to any healthcare system, you're doing a disservice, because I think you'll ensure people like me that you're not just, delusional when you point out the downsides. And even when you do point out the downsides, you'll make me feel more comfortable that it works, and it's still way better than the American system. So anyone who has comments down below, love all you guys. Anyone who has comments, any answers to any questions I had, anything I said that was wrong, high chance of that, if you could correct me down below in the comments. And yeah, would love for you to like and subscribe. And I'd love to check out a new healthcare system from a different country. I love learning about this. Yeah, I'll see you guys next time.